Everyone. How's everyone doing today?
Fine.
Good. I'm Dr. Faika Khan. I'm a practicing physician in New York. And it's a pleasure to honestly be here. I'm glad that I'm not back home in New York. It's freezing, it's snowing, and it's terribly bad today. So it's certainly been a pleasure to be here today in Pakistan. Of all the topics, I picked STD because I feel there's, we see these cases more so on a daily basis. But just because there's a certain cultural taboo and a misnomer associated with it, so I thought it might be a good idea for us to talk about it. And as you know, there's already been a pressure on us that we have 10 minutes, so I think we should just get to the presentation right away. So sexually transmitted diseases. STD, also known as the sexually transmitted disease, are infections that are passed from one person to another through sexual means. Most STDs affect both men and women, but it's far more important for it to be diagnosed in women because untreated STDs can lead to PID and eventually to infertility. So some of the statistics that go with the STD, about approximately 20 million new cases of sexually transmitted disease occurs each year in the United States. And the prevalence is the highest amongst the patients age group between 15 and 24 years of age. According to the WHO report of 2017, approximately 48 million people worldwide are living with HIV/AIDS, out of which 5 million are in Asia. As per the Pakistan Global AIDS Response Progress Report, Pakistan's HIV epidemic started in the 1980s when cases surfaced mostly amongst migrant workers being employed abroad. So ways in which STDs can be transmitted is pretty common sense: skin-to-skin contact, infected mother to child, sexual intercourse, of course, vaginal and anal, and of course, oral sex. Symptoms, pretty straightforward: pain or discomfort during sex or urination, sores, bumps or rashes on or around the genital area, unusual discharge or bleeding from the penis, painful swollen testicles and itchiness in and around the vagina. Types of STDs, we have a whole bunch mentioned, and then moving forward we'll go over each one of them and elaborate on them further. Chlamydia and gonorrhea being the most common bacterial infections. Herpes, HPV, which is usually harmless and goes away by itself, but sometimes can lead to genital warts or cervical carcinoma. Trichomoniasis, syphilis, which is more of a systemic illness, and HIV. So we went ahead and distinguished STDs into two categories: curable versus incurable. The curable includes chlamydia, gonorrhea, syphilis, and trichomoniasis. The incurable is the HPV, HIV, and herpes. So what is chlamydia? Chlamydia is the most common bacterial STD, at least in the US. Some of the means that can be transferred, we went over that in our prior slides. It's pretty much the same. Many people with chlamydia are carriers and don't show any symptoms. And just for that fact, the US Preventative Task Force strongly recommends screening all age women aged 25 age or younger and other asymptomatic women at risk of chlamydial infections. These recommendations are based on the epidemiological data showing the prevalence is highest among women aged 25 and younger. How can chlamydia be diagnosed? There are about two tests. One of them is the urine test, which is far more easier. The turnaround time is faster. It takes about 48 to 72 hours. The other test is the swab test, which is a higher specificity but lower sensitivity. Treatment for chlamydia is pretty straightforward. It's macrolide is the first line of treatment for chlamydia, and most preferable is azithromycin. So it's 1 gram orally in a single dose, or doxycycline, 100 milligram, twice daily for about 7 days. I usually use azithromycin. It's straightforward, 4 tablets, you give them once, no side effects, and they're all a happy go. Doxycycline has a lot of side effects, including photosensitivity rash, so usually I don't prefer that. Patients with chlamydia usually have a very high risk of having a co-infection with gonorrhea. So mostly when patients are diagnosed with chlamydia, it's always recommended that they should also be treated for gonorrhea. The treatment for gonorrhea is ceftriaxone, 125 milligram IM in a single dose, or cefixime, 400 milligram orally in a single dose. After treatment, patients should always be retested to confirm the eradication of the infection. Having chlamydia or having been treated for it in the past does not provide immunity against reinfection in the future. Gonorrhea, it's also one of the most common STDs. The prevalence is pretty much the same. It's the highest amongst patient age group between 15 and 24. Some of the symptoms include dysuria, postcoital bleeding, vaginal discharge. What are some of the risk factors? Of course, patients with multiple sexual partners, inconsistent use of barrier contraceptives, and prior history of PID or STD are the increased risk of getting the infection. For gonorrhea, the US Preventative Task Force recommends that all sexually active women, including pregnant women, be screened if they're at risk of infection. Once again, once you're diagnosed with gonorrhea, you must also be treated with chlamydia. How is gonorrhea diagnosed? There are about two tests. One of them is the gonorrhea